Welcome to another episode of Humans for Care Stories from Healthcare Leaders, our series where we speak with healthcare leaders about how AI is being thoughtfully applied in practice to enhance care qualities and operational effectiveness. In this episode, we are joined by Dr. Andrew Chou, Pediatric Orthopaedic Surgeon at KK Women's and Children's Hospital, Surgeon Innovator, and Singapore-Stanford Biodesign Fellow. Dr. Chou, thank you for joining us today.
Thanks for having me.
Right. So I would like to first step back and understand a little bit more about your broader philosophy when it comes to AI, right? How has your journey as a surgeon, innovator, and educator shaped your view of AI in healthcare?
I think as someone who wears many hats and sort of bilingual in both medicine and engineering, I've seen many trends rise and fall over the years. Things like robots, blockchain, and now AI. AI is a tool, and it's a very powerful one that's changing industries. But I think in healthcare, and particularly for me, where I treat children and kids who are amongst the most vulnerable patients that we see, change is a little bit slower. And it's particularly important that tools like AI that are powerful are used in the correct context, are used safely, sustainably, and ethically. And that's really one of my guiding principles when I've been approaching use of AI in the hospital setting.
Mm-hmm. Yeah, was that like really an aha moment where you say, hey, you know what, this technology really solved a real clinical problem, right? Or where do you see AI having the biggest impact across healthcare?
I think right now, AI hasn't reached the stage where it can replace doctors yet. I think they've been saying that for 10, 15, maybe 20 years. I think what's going to happen is that doctors who use AI will replace doctors who don't use AI. And it's really a tool that's meant to help. And the way I see it in its current state is that AI should be used to help us automate and make easier a lot of the tasks behind the scene that keep the whole healthcare machine going. At the end of the day, healthcare is still a business, and things like appointments, billing, care coordination, reporting, all those sorts of things, the nuts and bolts of medicine that people find very unsexy and very logistic, those are the things where AI can really make a big difference. And its impact can still be powerful without having so many of the concerns in the ethics or in the safety domain.
I hear you. And yeah, I've been hearing about, saying AI can replace doctors, right? It's kind of a little overhyped, maybe not yet. Right, but beyond that, we've heard about so many AI developments across, whether it's note-taking, scribing, or whether it's a chatbot automation, right? Where do you think AI is currently overhyped?
Where I think it's overhyped. I think right now the amount of information AI can provide is overwhelming. It's like about 10 years ago, we just started with rapid genome sequencing, and we had so much information we didn't know what to do with. Now it's not just the doctors who have this information. I have patients, I have parents, I have nurses and other doctors coming in with questions or concerns that they've clearly generated from ChatGPT or Ep.6. And while I appreciate the research that they've done and the effort they've taken to take charge of their own health, it's very apparent that some of the questions or some of the concerns they may have are a little bit overblown, or they've been driven by AI in a sense that these wouldn't normally be things they would be concerned about if they hadn't gone and asked the large language model that could scrape the whole of the internet in a few seconds. And so there's a real concern for me that we need to make sure that the resources that the parents and the patients have are appropriate, they're safe, they're vetted. And I've been really happy with some of the collaborations that we've done with CompatMD to try and make sure that the AI tools that's available to our patients are safe and help to empower them to take charge of their healthcare and not create more anxiety and more problems.
Yeah, absolutely. I'm glad you managed to highlight the key challenges, right? And also the collaboration that BoardMD has with you. Before implementing such an AI solution, we talk about human touch is absolutely necessary healthcare, right? How do you decide which processes are appropriate for automation, really without compromising the human touch? And how do you keep that human touch even when processes are being deployed as well?
So I am trained in the Stanford Biodesign philosophy. So I'm very much a big fan of needs-based innovation. So I really look to see where things are causing a problem in the clinical setting. And it's really important when you try and find a problem that it's a problem that affects multiple stakeholders. So it's not just a problem for the nurses. It's not just a problem for the patients. It's something that affects everybody. And I really saw that need in things like care coordination, in patient education, in trying to track outcomes. This was really a problem that I realized nobody was really able to solve. And I realized very quickly that we could use technology, not necessarily cutting edge brand new technology, but use existing technology and existing frameworks to try and make this something that we could make very effective, very frictionless, and very cost effective. And that's sort of how the AI registry that KKH and BotMD have sort of collaborated on came about. It sort of was the philosophy. It's like, it's really hard for us as surgeons to track the outcomes of our patients. And, on the same way, the patients really want to know, like, when can I go back to sports? When can I do football? When can I go for OBS? Or I'm fit to go back to swimming on the beach and stuff like that. And, the nurses and the physiotherapists, they're slammed. They have no time to track this sort of data. And so looking at the solutions, I approached BotMD. I was like, for better or for worse, kids are really great with phones and digital devices. Young parents are very tech savvy. Everybody in Singapore has WhatsApp. What if we used WhatsApp to collect that data asynchronously? And we could make it so easy and so frictionless that they could do this in the comfort of their own home. They don't have to come down, and we can flag them. On our end, we could track this so much better. And in this way, we sort of found a solution where it appealed to the parents and the patients really well. It was so frictionless and easy for the healthcare workers. And dollar for dollar, it was just such an attractive option that it made implementation so seamless. And when you try and align your stakeholders that way, if you can find a problem that cross-cuts across all of your providers, your patients, your physicians, your payers, then you could really find a solution. If your solution can satisfy all of these people, then implementation really becomes just a matter of knocking on the right doors and showing them the evidence.
What were the results like? Were there more measurable improvements in completion rates? How does it look like in your deployment today?
Well, before we didn't have any registry because it just wasn't feasible for us to collect this data. And today, I think as of yesterday morning, we have over 850 patients who've been enrolled. The compliance rate is great because virtually everybody in Singapore, even if they're a tourist, has WhatsApp. And we're collecting data across a wide range of patients, from orthopedic trauma, sports medicine, foot and ankle surgery, reconstructive microsurgery. And we're getting a lot more data that we have on these patients that we couldn't find, we never had before. And we're not just tracking how well the registry performs, but also the costs and how effective it is at doing its job. And we can, even our internal processes team have reviewed the data, and they're surprised. With a fully automated solution like BotMD, we're collecting easily 2-3 times, sometimes even 4 times better than the existing PROM solutions. And that's amazing, given that this is a bot that we spent a few weeks programming, set up, and now it takes 30 seconds for my clinical team on call to recruit the patients, and the chatbot handles the rest from there. Those results are astounding, and we are publishing them. We're sharing them across the world at top conferences, and people come up to me and they're like, "How are you doing this? What did you do?" Yeah. And I said, you just really need to look at the problem, find what is needed, and innovation in this sense is not necessarily coming up with something cutting edge or brand new. It's using technology in an intelligent, patient-centric, and cost-effective way to try and achieve what you need to do.
Thank you. Thanks for sharing. Now we'll just take a little step out, zoom out a little bit, right? What role do you see AI playing in pediatric care over the next few years? Right, we have seen evidence of pediatric surgery being improved by AI, robotics. We have seen chatbot implementation. We have seen many different of AI across multiple different domains. Which of them excites you the most, and which of them do you really envision it changing the patient care and clinician workflows over the next few years?
I really see AI moving in the direction of trying to address the part of care that's outside of the hospital. If you look at, especially with chronic diseases, and I do see chronic diseases, scoliosis, hip dysplasia, things that patients do have to monitor. And a lot of their care happens outside of the hospital setting. It happens at home, at school, traveling around the island, all sorts of things. And I think with technology advancing the way it is, we're really moving more towards remote monitoring and trying to collect more data outside of the hospital setting and using that data in an intelligent and clinically meaningful way. And you can already see people are moving in that direction. They want to wear Apple Watches. They want to use Oura Rings. They track their data with the Healthy 365 app. And they want to know, what does this mean? How can I improve my health? And I really do see that's an area we can really focus on. And particularly for kids, where that's my area of specialty, I really think there's a big room for not just remote monitoring, but also in patient education and trying to expand the ability for us to deliver care to parents. Part of being a pediatric specialist means that in addition to treating the children, I have to treat the parents.
Yeah.
Singaporean parents are a unique level of anxious. There's a lot of questions. There's a lot of concerns. And of course there are. And that's really where AI can actually help us deliver a more humanistic aspect of healthcare. I may not be able to answer questions and emails 24/7, but having a chatbot that is programmed to vet through guidelines, get help with rescheduling appointments, giving advice on when to seek medical care. That's 24/7. That's tireless. That can be accessed at any times from the comfort of their home. That's a level of care we didn't have 5-10 years ago. And that's where I see how we can take technology and use it to not replace necessarily healthcare, but to expand and extend our capabilities without having to lose that human touch. And even nowadays, research shows that sometimes ChatGPT and DeepSeek, these models perform better in giving more humanistic, more empathetic responses to parents than humans do. So it's not that AI cannot give empathy or give that human touch. It's just a matter of how you choose to implement it. And I really do think if you go in with the mindset that you have to make sure it's safe, that it's regulated, that it's ethical, that's done sustainably, that's done safely, then AI is very much something that you can use not just as a tool to extend healthcare, but to multiply its reach.
Right. Thank you, Dr. Chou, for your insights, and thanks for sharing with us. Today's conversations really reminded me of the future of AI really isn't about replacing clinicians. It's about designing systems that make care more consistent, more connected, especially in pediatric settings, right, where long-term follow-ups of and family involvement are so important and critical that the balance between technology and humanity becomes even more important. Thanks for joining us for our episode of Humans for Care, where we explore how innovation can strengthen, not replace, the people at heart of healthcare. Thank you.
Thanks for having me. Take care.
All right. Thank you so